And we can have a look at the structures in the posterior cranial fossa. Number 1, as we already covered, this is the 6th cranial nerve abducens piercing the posterior wall of cavernous sinus. This is the 5th cranial nerve trigeminal entering the Meckel's cave. This is the Meckel's cave, lies between superior petrosal sinus and the superior border of petrous temporal bone. Then these nerves entering the internal acoustic meatus, these and these are which nerves are these? Can it focus? It cannot. So these are the 7th and the 8th, that is the facial and the vestibulocochlear nerves entering the internal acoustic meatus. Then below the internal acoustic meatus is the middle part of jugular foramen, in which the 9th, 10th and the 11th cranial nerves, that is glossopharyngeal, vagus and the spinal accessory nerve, they are entering. You can see the spinal accessory, the spinal fibers of the spinal accessory coming from the cervical part of spinal cord through the foramen magnum. We can see the proximal, the lower part of medulla, which is continuous with the spinal cord inferiorly. From the first few cervical segments, these fibers will come and join the accessory nerve. So 7th and 8th nerves entering the internal acoustic meatus, but below that 9th, 10th and 11th nerves, these, if I retract the 7th and 8th above, then below that you can see the jugular foramen and the 9th, 10th and 11th cranial nerves entering that. You can also see the cut end of, this is the junction of transverse and sigmoid sinuses. Transverse sinus was running from here, torcula hierophili, it runs within the transverse sulcus in the posterior part of fixed margin of tentorium. If we look at the complete fixed margin of tentorium, it runs from the torcula along the transverse sulcus to the posterior end of petrous part of superior border of petrous temporal, and then runs along the superior border of petrous part of temporal to the apex of petrous, and then it gains attachment to the posterior clinoid process. Within this posterior part of fixed margin lies the transverse sinus. Within the anterior part of fixed margin lies the superior petrosal sinus. Here you can see there is junction of the transverse and sigmoid sinuses. You can see this is the sigmoid sinus going down towards the posterior part of jugular foramen. What else do we see? If we look here, these are the left and the right vertebral arteries, which will unite in front of the pontomedullary junction to form basilar artery. That this distal most part of the vertebral arteries and their union to form basilar artery, that has been taken out along with the specimen of brain. And finally, just above the foramen magnum, anterosuperior to the condyles, these are the fibers of the hypoglossal nerve exiting the hypoglossal canal on the left side as well as on the right side. Right. And then below we can see the spinal cord and the rootlets of the first cervical spinal nerves, which will exit above the transverse process of the first cervical, that is the atlas vertebra. Is there anything else that we can see? Anteriorly we can see this is the frontal air sinus and this is its mucosal lining, that is visible. And then this is the lesser wing of sphenoid forming the boundary between anterior cranial fossa and middle cranial fossa, and this is superior border of petrous part of temporal forming the junction between middle and posterior cranial fossa.